Hello and welcome to the National Family Support Technical Assistance Center's Office Hours series. This year, we're talking about innovative practices to sustain the family peer workforce. And today, we are going to be hearing from Willow Burgess Johnson and Fred Douglas from North Carolina Youth and Family Voices Amplified about integrating family peers into systems and onto support teams. We're really grateful for our funding, which comes from SAMHSA. Today, the webinar presenters and staff do not represent the opinions or official views of SAMHSA, but we are extraordinarily grateful for them providing us funding so that we can offer free trainings like these. We will have a feedback survey at the very end of our session. You can get a certificate of attendance, which comes at the end of that feedback survey. You should be directed to the feedback survey as soon as you close your Zoom window, but we will also have a QR code and link in the chat for you to access that. We do not offer CEUs, but this will be a certificate of attendance. You will also receive a link to that feedback survey to get the certificate of attendance about 1 week or less after the presentation. That follow-up email will have also a recording of this webinar, as well as the slide presentation and any materials and links that are shared in the chat or by the presenters or audience members. Your microphones are muted right now, and we ask that you do keep those on mute during the presentation, but we will open up to a Q&A session after the presentation, and you are able to unmute your microphone and ask your questions live. You can also ask questions in the chat throughout our time together today. The presenters will be checking from time to time, and if we don't get to your question while they're talking, we will have time afterwards. And any questions you have, you can email me afterwards, and my email is there and also at the very end of this slideshow. We at NAVSTAC use family-driven language. That means that we are trauma responsive, strengths-based. We don't blame caregivers. Our language is inclusive, person first, respectful, non-judgmental, and we try to use language that is then consistent with our actions. We ask that you use family-driven language while you're in breakout sessions, during the Q&A portion, and in the chat today. So as I mentioned at the very beginning, our series this year is Innovative Practices to Sustain the Family Peer Workforce. We have gone out to our affiliates, our partners, and other people who are working within the behavioral health field and family peer workforce in particular to find out what they are doing that is really moving the family peer workforce forward. So we hope that this series will help support family peers to add some of those practices to their own toolboxes. We also hope that this is an inspirational series to any leaders and emerging leaders so that they can really do that work to sustain their particular organization and also grow and sustain the family peer workforce itself. We also hope that some other members of the behavioral health workforce, providers, system staff, agency staff, will be coming to these and learn some family support practices and understand how to better integrate family peers onto support teams. And that is really what we're talking about today in particular. So at the end of today's office hour, we hope that you'll be able to identify 3 audiences to strategically target messages about family peer support to. We also hope you'll be able to identify multiple areas for policy consideration when integrating those family peers into an existing organization, and to share the family engagement and systems assessment with systems staff to understand how well they are engaging with families. And you'll have a chance to tell us how we did at meeting those objectives when you do that feedback survey at the end of the presentation today. But let's start out learning a little bit more about your experience. Does your workplace have a policy around including the lived experience in hiring interviews? You're going to get a link in the chat that you can follow. You can also go to www.menti.com and you can type in that code at the top of the screen there, 83860361, and let us know. Does your workplace have a policy around including the lived experience perspective in hiring interviews? Looks like a lot of folks' workplace does. One person so far does not, and one person is not sure. But This is very encouraging to see that so many of you have these policies in place. If you are in the no category, that's very interesting. You could type in the chat whether or not you think that would be valuable for your workplace to add something like that to their hiring process. But it looks like we've got a majority of folks today who do have this policy. That is really, really phenomenal. Keep answering if you haven't already. I'll put the results of the poll in the follow-up slides. So this would be really interesting to see what our final numbers are. All right, well, let's get to our presentation. We have two wonderful speakers with us today. First is the program manager for North Carolina Youth and Family Voices Amplified, Willow Burgess Johnson. She, in addition to that role, she's also the director for Healthy Transitions North Carolina at UNC Greensboro. She has both personal and professional experiences, including her own mental health journey and advocating for her child. And she is a true champion for the expansion of youth and family peer support in behavioral health services. She is doing amazing work in North Carolina, and we want to give them a really big congratulations for getting family peer support and the importance of supporting the national certification of family peers in North Carolina, codified into law in North Carolina with some funding. So congratulations to that. And we are so excited to learn from her. She's got some really great professional and personal expertise. We are also honored to have with us the Certified Family Training Coordinator of North Carolina Youth and Family Voices Amplified, Frederick Douglas. In addition to being the mother of 3 beautiful daughters, grandmother of 5, and great-grandmother of 6, Fred is a really talented trainer who has been really overseeing the training of family peers in North Carolina. She has her own mental health journey, both personal and with her children. She sits on local, state, and national committees. She has assisted in developing a system of care course at UNCG, and she has over 30 years of experience as a family peer and training family peers and families. Fred is truly impressive. She has a wealth of knowledge in this field, so we are really lucky to be learning from both of these lovely ladies. And I will turn it over to Willow to tell us a little bit more about their organization.
Thank you so much, Dana, and welcome everybody here today. I am so encouraged to see so many folks from across the country. As Dana said, my name is Willow, and I am the program manager for North Carolina Youth and Family Voices Amplified. We are a program that is embedded in a center at University of North Carolina in Greensboro. We have a contract with the state of North Carolina to provide training and technical assistance for youth and family peer support across the entire state. What that looks like is we provide a lot of online training, in-person training, and a lot of technical support, both to family peers, youth peers, to families and youth in the community, and then a lot of system technical assistance as well. In 2023, we trained 408 individuals. In 2024, we trained 536 individuals, and we support all kinds of settings that family peers work in as well. So in North Carolina, family peers are currently employed in community-based mental health centers, in our health plans as care coordination extenders, in provider services, in high fidelity wraparound teams, and in North Carolina, we also have some family support partners that are part of our enhanced mobile crisis teams as well. So go on to the next slide, please. So as we are looking at how do we support family peers in North Carolina and families in North Carolina, we really wanted to take the approach for the whole state, looking at 3 different layers of support in North Carolina. So we're trying to look at how do we support not just family peers, but how do we support those who are needing their support and going to who could potentially become family peers? And then how do we also support family peers in their own development and longevity in this field? And how do we support the places where those family peers work? How do we support those employment and workplaces so that those are family peer friendly, that those are places that family peers can not just survive but thrive for a long time, for a very long time. Next. Fred, did you have something to add?
Oh, I'm sorry. No.
Okay. So we're going to start talking about the community level of this work. And Fred, do you want to talk a little bit about why we go out into the community, why we start and base a lot of our work out in the community?
So first of all, hello everyone. I'm so excited to be here today. I'm excited to see each of you who are here. And I'm going to go ahead and say I'm a old timer. So I've been doing this for about 25 to 30 years. I was involved in the initial conversation about defining family partners or family peer support in North Carolina. So today I was just going to share just a little bit about best practices we have learned over the years about implementing the role of family peers into systems and support teams. So we can call this little session, this is how we do it in North Carolina. So we just want to share some things that we think have been helpful for us and that might be helpful to you wherever you find yourself. What we have found is that while it is the family peer that brings authenticity to the process and they are a valuable piece of the model, they do not and cannot exist in a silo. Collaborations must be created, partnerships must be developed in this circle of services and supports if the workforce of family peers to be effective and sustainable. So when we think about family peers, we in North Carolina have identified 3 areas of engagement: the community, the family peer workforce, and best practices, guidelines, and procedures for family peer employment. Could we get the next slide? So as we think about community engagement in this workforce, we have identified some of the avenues to community partnerships, and one of those is community collaborative. This is one of the key opportunities for engaging our community and family peer support. We just want to share with you that in 2001, when North Carolina took system of care statewide, the Division of Mental Health required that every county adopt not only system of care principles and child and family teams, but also community collaboratives. And in 2006, the NC General Assembly appropriated recurring funds for this process. And this was to our advantage that this did occur. So within the community collaborative, what's expected is that families will partner with mental health agencies and providers, schools, housing, faith-based entities, and other surrounding community shareholders in service delivery discussions. So many of the family partner positions in North Carolina are found in specific initiatives, and they have specific protocols, mandates, and guidelines. However, there is an important opportunity found in the framework of the community collaborative for the family partner to share information about the family peer role, but also an opportunity for family peers to promote and be reminders of systemic care values and principles and family-driven care and all those good things like youth and family voice. Although there may be challenges in respect to time, funding, and deadlines within grants and specific initiatives, best practices teaches us that the family peers cannot exist in a silo within their own initiative. So we are excited that our family peers, there is a promotion for family peers to be involved in the community collaborative. In order for the community to be engaged, we must be visible. So we want our family peers not to just be hiding behind an initiative in a certain space, but that they're out, they're visible, they're being seen. They're in meetings where you're talking about public health, you're talking about housing, you're talking about juvenile justice, schools, churches, and on and on. Because again, we are wanting to make sure that our family peers are not in silos. One other way that we engage our community with family peers is we have parent cafes. And these are designed for the family peer to share information. And this is like actual families coming together, actual parents. And we talk about things like family-driven care, because many times if when funding is allocated, there's a lot of training for everyone but the actual parents and the actual children that are being served. So this is just an exciting opportunity for us to share information about what a family should expect in their service delivery and what their thoughts are around it. So we have the parent cafes, they're confidential spaces. And we just want to make sure, though, that when we're doing the parent cafes, that we are providing, some of the traditional things that we have learned about what's needed to engage parents and families in these kind of conversations, childcare, transportation. And so we want to just, provide this opportunity for the actual families to come together to share. We talk about resources, and we also promote compensation for those who are participating. Because in so many of the meetings that I have been a part of where these families come together, there are so many ideals that are heard or captured from the conversations around families. And so we want to compensate them for that. We also have the family advocacy training that we do with NC Voices Amplified, and that's done virtually. And, we do some of the same kinds of things that we do in the parent cafes in order to really share information with the families. And then we also do in the advocacy training, this training is open not only to just parents and families, but it's also open to agencies, organizations, because the expectation is that the family is going to be important for the agencies to be cheerleaders for the family peer role as well. We do outreach. Finally, I'll just say we have a family resource directory on our website, and we do outreach events where we just, set up tent wherever they're having something out in the community and just share information about our role. So Willow, you know me, I'll just go on and on and on. So, I know there's 2 more slides, but how do you want to move forward? Do you want me to talk about the workforce?
Yeah, let's go ahead and start talking about the next level, which is actually working with the family peer workforce and all of the fantastic work that you're doing there.
Okay. All right, so we have a partnership, of course, with the National Federation in supporting families, family peers in their certification. And in their preparation for the certification, the applicant must complete the North Carolina Youth and Family Voice Protocol. And that just really is meeting the criteria that the Federation requires in order for them to apply for certification. 88 hours of approved trainings. Within North Carolina, we have 5 required trainings that we require in order for our family partners to move into the forward in that process. The foundational training is Family Partner 101. This is a training that really does set the tone for the understanding of the family peer, who they really are. Because many times when they find themselves in agencies and initiatives, being hired in these different areas, it's important that they're able to remain true to their who they are, what their role is. And so we want to make sure that they really understand who they are, what their role entails, understand family-driven care. We talk about confidentiality, non-judgmental approach, family-driven approach. Some of the same things that the Federation spoke of earlier when they were speaking about how the approach that we have when we talk about family peers. The ability to be objective, developmental stages, parental skills and strategies, and definitely self-care and stress management, which is extremely important. So we have that foundational 5-day training. All of the trainings are free, 5-day training. We also require that they take child and family team training, wellness recovery action plan training, trauma-informed training, and motivational interviewing training. Again, all of these trainings are provided by our agency, our program, excuse me, and they are free. We have NCBA monthly technical assistance call. In my role, I provide a one-on-one confidential space for the family partner to just, brainstorm around any challenges they may have incurred. We talk about, I link them to the trainers, make sure that they are on point with when the trainers are taking place, making sure they have the links to registration and the virtual training links. And talk about anything they want to talk about, any kind of issue, concern, or even a success that they would like to discuss. And so that's a monthly, it is flexible because we recognize that they have jobs to do. They serve families. However, we assign that monthly meeting, and of course they have a challenge with it. We reschedule, but it's just an opportunity for them to be in a safe space and talk about what their needs are, and also it assists me and it helps me to kind of capture some of the challenges they may be experiencing, so that I can then share with, perhaps anonymously, with others who may be making decisions around the family peer role. And then NCBA, we have the quarterly family peer meetings. We do shout outs in our newsletter, our quarterly newsletter, to family peers for successes and completion of certification. And we also provide scholarship funding for persons who are approaching certification. So we assist with that. And so next slide. Oh, we're there. Sorry. Employers.
You want me to talk about professional development, Fred?
Go ahead.
Actually, if you can go one back, I'll talk about workforce professional development. Thank you, Fred. So as you all can see, we're trying to tackle this from a systems lens. Or a multi-layered lens. One of the things that we want to include in this is also an opportunity for professional development for family peers, to ensure that there's a pathway for growth, to ensure that there is a vision for a future for family peers. So we're also working towards specialization trainings, as well as ensuring that we have a basic skills training that every family peer gets to on their way towards certification. We're also looking at post-certification trainings to ensure that we can add some specialization skills for some of our family peers, especially if they're working in some of our more complex systems, such as child welfare, juvenile justice, foster care, education, those kinds of things, so that we are really, my dream is to get family peers embedded in all of our systems, and to really have specialized family peers that can support families in every system where families are needing to navigate those systems. So really want to ensure that we have that level of support built in for our family peers as well. Next slide. So one of the pieces in North Carolina that is happening more and more as we are looking at how the system as a whole is developing is the kinds of places that family peers are working is shifting. So in North Carolina, historically, family peers was really a grassroots movement. And a lot of family peers supported other families because that's what needed to happen. They saw a need and filled that need. And now, and so a lot of family peers were volunteers or created their own nonprofits and scraped together funding. And one of the things that we're seeing in North Carolina is there is greater recognition of the value of lived expertise and greater integration now of family peers into more traditional behavioral health agencies. And along with that comes some benefits and some risks. Some of those benefits are increased stability and increased potential for long-term career advancement for family peers, but it also means that we've got to do some extra groundwork to ensure that family peers can be integrated into those more traditional agencies and maintain their role in a way that is really meaningful. And so some of the strategies that we've employed to ensure that we are also supporting the agencies that these family peers are going to end up in so that we can set everybody up for success is to really take a look at how are we training agencies? How are we communicating with agencies around the value of lived experience? How are we ensuring that agencies understand why family peers are so valuable and what it can do for the whole agency? And to ensure that there is not just that one champion in the agency, but there is a deep understanding from C-level suite throughout the entire agency. To ensure that hiring and interview supports are adequate and that there is a deep understanding of the kinds of HR policies in particular that need to be in place when you are hiring people specifically for their lived experience and their expertise in caring for family members who might have more challenges and more needs than other employees. And therefore, are your HR policies adequate to accommodate that? Are all of your policies adequate to accommodate that? And then the other piece is really looking at supporting agencies in ensuring that they are integrating family peers into the entire agency and not just saying, oh, great, we've got this brand new shiny bauble that's over here all by itself. Go do your thing. And we're over here, we're going to do our thing. But really ensuring that there's not just lip service paid to that lived experience integration, but really, really ensuring that there is a deep understanding and integration across all supports provided so that everybody understands how can the family peer, that model, be integrated into all kinds of supports? How do we reap those benefits across an entire agency? How do we help that agency understand how family peers can plug in appropriately and maintain their role? And most importantly, not get used as a new grunt worker to file all the files and take out the trash and clean the bathrooms, or get sucked into a hyperclinical role, which is also really, really inappropriate, so that folks can really, really stay in their lane and use that role appropriately to very much support folks. Next slide.
Well, if you don't mind.
Oh, sorry, Fred, please.
I'm sorry. I just wanted to kind of talk about a little bit about my role and in technical assistance around that in North Carolina. And for the things that we really have identified is that it's important that agencies, coaches, supervisors, organizations first understand the purpose of the family peer, which is extremely important. That they understand the significance of the family peer's authenticity and their perspective, as Willow was speaking about. If they don't understand that perspective that the family peer brings to the table, many times they'll just ignore their voice. They will not include the voice. They may include the voice in a discussion or conversation, but they don't include the voice in decisions that are being made. We want to make sure that they understand the importance of the family peer specialist, and that they understand their value, and that they understand that the technical assistance around the family peer role must come from the expertise of family peer run organizations and programs. And then they look to that, to them for that expertise. Many times, the policies and the staff requirements, as Willow indicated, are often built upon clinical staff needs and do not consider the family and youth role. So it results in a structure and operation that do not fit the work of the family peer, nor does it provide the support and professional development that's necessary for it. And so as a result, you have family partners, as Willow said, being utilized outside of what their frame of work or their expertise is.
Thank you so much for that, Fred. So some very concrete places where agencies can dig in and really look at, okay, are our policies actually addressing the needs for family peers in this agency? One of the easiest first steps is to take a look at the Family Peer Specialist Code of Ethics, to read, for whoever is in charge of policies in an agency, to read through that code of ethics and make sure that none of the policies of the agencies are in conflict with that code of ethics or would put a staff person in conflict with that code of ethics. The link is in the chat. It's a very easy resource to provide to an agency. The other, as I said, is to take a really, really deep and thoughtful look at leave and benefit policies, especially around things like short-term leave, FMLA policy, an ability to move from full-time to part-time if needed. Those kinds of employment flexibility are really, really important when you are hiring a workforce specifically for their experience in needing to navigate high needs from their family. And then the last is also another area, is really thinking about hiring and supervision policies. So I was thrilled to see so many of you say that, yes, you have in your interview process that consideration around lived experience. Absolutely. That is so vital to include that piece in that interview process, because it is such a different thing for most people to figure out, how do I ask about this? How do I talk about this? How do we have this conversation and tread lightly around some of those areas around HR concerns? Even how am I reading resumes? Because most of the time, folks' employment history shows up very differently. So ensuring that agencies are knowing and prepared for all of these things as they are welcoming family peers into the agency and looking at how to integrate those things. All right. Fred, did you have anything else to add around policy pieces?
I mentioned, what I mentioned before about the policies, but I did want to add what NC Voices Amplified does provide to employers kind of a preparation. We have a preparation training for agencies who hire family partners. It's called Family Support Partners and Youth Partners in the Workplace, because it really is a real concern when family partners are hired and placed in agencies who truly do not understand their value and their purpose and the supports needed in order for them to be successful. I also provide support in the interviewing process. I sit on the interviewing teams to assist them with identifying authentic family partners. As a matter of fact, sometimes I am available to do screening, to just screen the lived experience prior to the interview. So many one of the things I think is so important, that was one of the things I wanted to say about the Parent Cafe, is that within those family cafes, we are really able to recruit family parents to become family partners, because it is extremely hard to identify authentic family peers from a job announcement or Indeed or something like that, because many of them, when they ask for that lived experience, they think can be lived experience just supporting a young person. They don't understand that you have to be the parent of a child who has access services. So I provide that type of technical assistance in the agency as well.
Thank you so much, Fred. All right, we are going to move into breakout rooms next. And when we're in breakout rooms, of course, we ask for you all to use person-centered and family-driven language. We ask you all to focus on strengths, solutions, and future opportunities rather than just venting. We want to make space for all voices, so we ask you to use the 3 then me philosophy if you've shared already. Leave room for 3 others to share before you're contributing to the conversation again. And save presenter questions. If you have questions for Fred and I, save that. We'll have some space at the end for that. And you can hang out with those questions and use the breakout room to discuss the breakout room question. So before you head into breakout room, we're going to pull up the slide from the breakout room discussion. I'm going to suggest that you copy it, and then you can put it in chat and still see the question. Some of the breakout rooms will have a facilitator in them. If you are in a breakout room that does not have a facilitator, I'm going to ask that you appoint amongst yourselves a note taker and a facilitator. We will come back to the large group in 12 minutes after you all have a chance to discuss the question. Identify the audience that most of your messaging or your agency's messaging is targeted to, and discuss additional audiences that might be helpful to target and what messaging might be helpful. All right, we're going to head to breakout rooms now. You should find yourself in a breakout room momentarily. Great, thank you all so much for that conversation. Does anybody want to just share if there are some insights that came out of that? Does anybody have just a burning insight that they're dying to share from that small group discussion?
Well, I think one of my burning insight anyway was that the older we are, possibly the more experience we have, the more lived experience we have, we don't feel like we're valued for that. we feel like that the organizations are looking for younger people that have come out of college with this fancy degree, but a degree's not going to help you walk through the night with a kid that won't sleep, the kid that has this issue or that issue. That degree don't mean nothing. And I think that that's kind of where we were headed. It was like we feel so underappreciated.
Absolutely. So that messaging, that systemic messaging about the value of lived experience and why it is so important to include that lived experience perspective, why that seat at the table is as valuable as any letters behind anybody's name. And that messaging, really, really focusing in on that messaging so that everybody understands how that contributes to the whole and how much that can contribute to really shifting the whole conversation. And the piece that having letters behind your name does not contribute to the conversation. I think that's the other part of it, is that it's not just about equal valuing, but it's also about filling in pieces of the puzzle that are not at the table otherwise, and being sure that that's also recognized. Any other burning insight or insights that folks were able to come to?
Miriam has her hand up.
Thank you, Miriam.
Thank you. Our group, the four of us were from 4 different states. So I had a question at the end, and I think one of them was going to answer and I forgot. But my question was, is there some sort of data on the pockets of the US where this has really been accepted and is up and running and a part of this, lots of systems, and parts where it hasn't been as accepted? I'm talking about peer family services.
Family peer support. That's
Yes.
a great question, and I am going to defer to my NF
Yeah. Yes.
colleagues to help answer that.
That is a question that is a really big question that might be outside the scope of our time together today. But the short answer is that it is very much state to state. We have a national family peer support certification that is used in multiple states. And that certification program is a model for a lot of the state-based programs as well. But as far as how family peer services are offered, how they are funded, that is every state is completely different, and we do have some other trainings that are recorded that speak to that. So Miriam, I'll invite you to email me and I can send you some links about that. But that is a really big question. I don't know if Willow or Fred, you have more to say about that.
Thank you.
Yes, absolutely. And I do see lots of hands. I do want to let everybody know Fred and Willow have a few more things to say. So this isn't the big tent Q&A time, but
Yep.
Please do continue to share insights from your breakout room at this time.
Yeah, I want to be sure we have a whole Q&A section, but I do want to be sure that we get the chance to share this resource with you, because there's one other part of this that I want to be sure that folks talk about, which is the other part of family peer and engagement. So I'm going to ask if you have a insight from the breakout session, please keep your hand raised. If you have a question that you think might be able to be held until the Q&A session, put your hand down, please. All right, it looks like Bonita has a question or an insight to share.
Yes, we were fortunate in our small group to represent kind of a broad brush of different audiences. And I think what stood out from that is just how varied and diverse family peer support is. Everything from especially medical care clinics to the children's health system. And in our group, we're fortunate to have a representative from the state task force on the opioid problem in tribal communities. So that really impressed me and reminded me of how important it is to remember that we have lots of target audiences and how important outreach is for each of those so they understand what the specific type of family peer support offers.
Thank you. That is a great reminder. Yes, that level of understanding. To understand what family peer support is, it can be a beast to understand, and so internally it can be hard to understand. In this community, it can be hard to understand. So, speaking to everybody in the external world as well is really, really important. All right, I see one more. Sarah, move on. All right. Let's go ahead and move on then. So the other piece, again, to really support the entire system in evolving to be able to integrate that lived experience perspective. The other tool that I want to share with you all, and this is not mine, this is something I got trained on. This came from Family Voices, but if your state is like North Carolina, there are a lot of organizations and committees that have a mandate to include family voice or lived experience voice. And while I absolutely applaud the initiative and the motivation behind that, one of the things that can be very, very frustrating is that oftentimes plays out to look like I've got a family member's email on my list of who it is that I send out the invite to and who I send meeting minutes out to. And so there's not very much actual meaningful engagement with families in planning committees and advisory councils, in governing boards, all of those kinds of things. And so I was super excited when I found this tool to help it's called the FESAT, the Family Engagement Systems Assessment Tool. And this really is a self-assessment tool, but can also be used as a planning tool. So if you'll go to the next slide, please. It looks at four areas or four domains. So it looks at commitment to family engagement. So if you are a group, how are you actually logistically involving families or youth or whoever it is with lived experience in your group? When are you setting the meetings? How easy is it to get to these meetings? Are you actually compensating people to be there? Is everybody else getting paid by their job to be there, but not the family members? So what is the agency's commitment or the group's commitment? And how is that demonstrated to this family member to have them engaged in this group? What does transparency look like? Is there transparency in this group? So when there's got to be a decision made, does everybody else in the meeting get all of the information and the data to look at to make that decision except for the family member? Is there transparency about how decisions are made? Is there transparency about what happens with the data, about how much impact that family member is going to have? It looks at assessment around representation. Are you asking one family member to speak for all family members regardless of what their own experience is. So are you actually, if you are looking at making decisions and policy around what happens for an entire community, are you actually asking representative members of that community? Or are you only asking one person to speak for an entire community? And then how are you documenting the impact that this family member has when they are at the table? So when you're making a decision that includes family member feedback, are you actually documenting that, the family member's feedback was this, and it actually impacted and changed the way the outcome of the decision that got made, so that the family member knows it matters that I'm at the table. It matters that I give up my time every week or every month or however long it is, to come and share my experience with you. There's a reason that this matters for me to put my time into this. And so the link is in the chat. This is not a copyrighted tool. So it is something that you can download for free. It's something that you can use and you can tweak if you need to change the language slightly to be able to adjust it to use for youth or for families or for an individual. But it is something that I found extremely useful and helpful. Like I said, it can be used as an assessment tool, but it can also be used as a planning tool. If folks are scoring rather low on this, it can also point out some areas that folks might want to be planning for and more thoughtful about. All right. I believe that takes us to the last slide or Mentimeter, which is to talk about the really, really, really big picture part of this, which is asking about, does your workplace measure the impact of family voice? Because now we're talking about nationwide, as somebody was asking, where are things moving and where are things not moving? Measuring the impact, how do we know whether this is actually helping families or not helping families? It's going to make a really big difference. Looks like we're about half and half so far. Oh. Oh, good. It looks like a lot of places are, which I'm really glad to see. Again, this is going to be a building of collective understanding of how family peer supports impact families and being able to measure that over time. It's going to be a collective support. Really glad to see that a lot of folks are actually taking some measurement of this. Give it just another minute or two. All right. Looks like more folks are measuring the impact than are not. That's fantastic to see. All right. All right, I believe
It's time for our Q&A portion of the day. So now is when, if you have questions, you can type it in the chat, or you can raise your hand. And Gail is back with us, so I'll let her come on and do that.
Okay. Dana, you were doing such a good job. I was just going to let you stay there, but I'll be happy to facilitate the question and answers. If we could raise our hand, that would be helpful for me so I can know who to call on. So anytime you're ready, we love to have a dialogue here. So please ask questions. This is your time. Willow and Fred are experts here.
And this is Lachelle. While people are thinking about what their questions are, earlier in the chat, someone asked the question, does anyone here understand why this FPS system is not typically available in the DD, developmental disability community, without the mental health component?
I'm from LA County, and here the wraparound model is a good example because it always has a parent partner, and they are developing. I know Children's Hospital of LA, they have a program where they have the parents assisting families with children with medical or intellectual or any other type of disabilities. I know a lot of school systems are also including it. So in LA County, it is being used a lot more, and they're being recognized a lot more, especially because almost at the same time, state certification happened, as well as a 988 and the crisis unit started. So crisis units is another one that's using peer support, and that includes parents. So in California, it's developing really fast. Unfortunately, it's just wages is not what's catching up. And, for having all this training certification, that's the one thing I think we still need to advocate for ourselves. A lot of professionals think that because you do not have a diploma like they do, your voice it doesn't count as much. And I think that's the next big hurdle we need to have. And then in the states that don't, the biggest hurdle for them is having Medicaid recognize the importance so that Medicaid can become involved and then enhance these programs.
Well, let me just say one thing. Medicaid has recognized family peer specialists. It's in the Medicaid rules. What has happened is that in individual states, it's up to the individual states, and I'm going to give a little push here, and the family-run organizations to come together to make sure that they know that. I would always recommend pulling out the Medicaid regs that say it is recognized and bring that to your state directors and say, look, family peers are recognized by Medicaid. It will be covered. 38 states cover it already. So I always think that is one thing. And if you heard President Obama's first State of the Union address, there was a speech in there. There was a piece that he said, we absolutely need adult peer and family peer specialists and expand the funding. So I know the administration is turning over, but that's written in the rules, both the Medicaid rules and the will of the administration may change, but at the moment it doesn't look like it will. Jill, I see a hand up. Do you have a question?
I do. Hey, Gail, thank you. So I kind of work alone as a family peer. Is there and I probably just missed this, is there a national support system for peers? Like where we could get together more often and hear about each other and what's happening?
Well, actually,
Yeah, you've tuned into it.
Sorry,
I
Will.
know. Okay, I'm here.
This is sort of where it's at, but I'll defer to Willow. Go ahead.
I was just going to say the same thing. This is, you've tuned into it. This is
Yeah,
a great network for it.
it is.
And as you get to know folks, you get to know folks that they know. It's a good place for word of mouth, and going to conferences. But yeah, it's a good place to network.
And
Oh,
I'd say too that this is a great place nationally to pull everyone together. But if you determine that there's a need within your state, that you just have a meeting and invite family peers to participate. And I would suggest that it be a confidential space where they could really talk about the kinds of things that may they're presented with in their challenges, and that they are able to discuss and brainstorm around, and each person brings something to the table that another person can adopt. And so I would say this is a great place, and then you could do the same thing within your state.
Any other questions? I see a question that was in the chat earlier. Let me see if I can read it right. My experience so far in Ohio is that those of us who are CFPSs who also have related degrees do not get compensation for our education other than our certification. Is this the case in other states? Question mark.
That's a really good question. I don't know about in North Carolina. We haven't done an across the board salary survey. Um, I know that in budgeting, as we're budgeting like grants for organizations, looking at that, oftentimes we look more at cost of living, honestly, and living wage, to try to ensure that that is the minimum that we are looking at, and then look oftentimes more at experience. But you're right, looking at education levels and looking at that growth pattern, and ensuring that that is in place for folks, so that there's that trajectory and growth path for folks, and ensuring that there is a compensation that goes along with that as folks are growing in their own career development and in their own path, and have longevity in that is really, really important to build into the system. We don't have an official track for that right now. Honestly, the first hurdle is more has been looking at state tiered system for state workers, and looking at educational requirements for that has been one of our bigger challenges in terms of our career banding, has been one of the bigger challenges in looking at qualifications and education.
And I also, go ahead, Gail.
That's true for a lot of the country. Go ahead, Fred.
No, I was just going to say that it's also important that we define what education means, because, education doesn't necessarily just mean, what you have attained through academics, through university, but also education is training, so I just think that if we're going to begin to look at it from that standpoint, we need to make sure that we define what education means, and that it is, because sometimes it can be apples and oranges when it comes to salaries. And it's important for us to value it all, and how do you value it, and what structure is in place where you are hired in order to value those different aspects of a family peer. So.
Mm-hmm. And as a rule of thumb, years ago, before I was with the Federation of Families, like back in 2008 or 9, they came up with a procedure that equated 5 years of family primary caretaker experience navigating the systems for their child was equal to a bachelor's. And I know at that point, I got that information and I used it at the state level for the state that I was in. And they weren't really ready to accept 5 years, but they accepted 10 years of that experience to equate with a bachelor's if you did not have a bachelor's. So those are some of the ways you can actually push and advocate in your own state. I have a question here, and I think I need a little more definition or explanation with this. So I'm going to read it, and whoever wrote it, if you feel comfortable enough to come on and ask the question yourself, I would love it. It says, do you have lived experience defined in a way that is empowering versus all the other things it could be? And Willow or Fred, if you know what that, if you can have an answer for that, that would be great too.
That was me. I just find that sometimes it's used to, it's just like the comments, it's used to other families, family members, as opposed to empower them. And I was just wondering if somebody has a really good definition that they like using that supports families members.
I don't really understand the question.
I'm sorry, I don't either. Could you
Just-
restate
So
that?
the question is, lived experience can be defined a whole bunch of different ways. And I was wondering if you found a definition that you really like, that you feel is most empowering, because sometimes it ends up dividing people into categories, even within the lived experience categories. And so just in your work, if there's something that you really feel is good.
So in North Carolina, we define lived experience as being the primary caregiver for right now of a child who has significant emotional or behavioral needs. That's it. That's the definition. One of the conversations that has been sparked recently that I am still chewing on because I find it very, very interesting and I think is worth further exploration is the difference between lived experience and lived expertise, which I think is also really, really interesting, and I think can really further this movement and deepen the understanding of what the value is there. We all have experiences that we go through, and I think family peers oftentimes choose to use that experience and get further training and get further, use that in a different kind of way and turn it into an expertise. And so really kind of that difference between what we experience and then what we do with that experience is I think very meaningful in terms of the work that we're doing.
And I think too, when you're talking about family peers or family partners, that you're lifting up a person who is not only a caregiver for a child or a parent of a child who has access, services, but that they have navigated the systems and that they've had decision-making authority of that child, because it gives them as a specific expertise of all of the stigma and all of the experience of actually supporting a child who have these kinds of issues. So I think navigation is important to include. I think decision-making decision-making authority is important to include. And to me, that's empowering, because something that you have had to do that may have brought you pain and may have, provided some really dark places for you, it's now something that can be utilized to support someone else.
And Kim, if I can just, I think I understand what you were talking about. When you use your lived experience, suddenly some organizations diminish that, or they give you a pat on the head instead of saying, oh, you were, well, I can give a good example. I was the CEO of a provider organization in one state, and I came to another state, and I was a family run executive director. And it took a while for me to get overcome from the state officials and everybody to realize that I knew what I was talking about, because they would pat me on the head and go, good lived experience person, good lived experience person. So yes, Kim, that does happen. What we have found and what we at the Federation of Families does recommend is if you're allowed in your state to do some training on basically on the road to family driven supports, really train why being a family member with lived experience is important, and really train those policymakers, or set up a policy making or a lunch and learn to really start changing or doing a culture shift in that area is very helpful. And I see a ton of hands. So Bonita, you're next.
Yeah, I love Kim's question because my team and I have been working on a role description for family peers that emphasizes our unique contribution. And I think that's the key, is that we can, through our lived experience, offer something that no other team member can have. And I'm just going to pop the intro to what we've developed in the chat so people can read it. And we're a specialty care clinic for young people just starting to experience psychosis, so it's targeted to that. But I think we're trying to really capture the positive contribution of family peers that's different from anybody else. So
that's beautiful.
Yeah.
That's fantastic.
Sorry,
I love hearing the actual recording of the why.
I wanted to add something. I just found my voice finally, because when I was in a meeting in the breakout room, for some reason my audio wasn't working. I just wanted to add, because I came to the work that I do voluntarily, and as a mother who has a child facing the unthinkable, that's how the world describe it. I find my voice, because when I wasn't heard in providers and things, with providers and things like that, I, I found the organization who I work, I do this now, which is Favor. And with the trainings that they provided, which is webinars with my certification, now going on almost 3 years, I find my voice, and I'm able to sit at meetings. So it doesn't matter that I don't have a bachelor or master's, because when you are able to put your emotions aside and you learn how to speak in, in this meeting, or with, when you go to the Capitol and all these things, they they listen to you in some way. Somehow you are able to change, for yourself, or you talk on that area because you went through it, but you are able to help those that are going through what other people are going through, even though at that time it wasn't for you, but now that I sit here and I was talking in the meeting, I said, even though I went through the difficulties, I sit in meetings and I'm able to change somebody else's. And based on that, it's wonderful. So I know the lady that Miss Kim, um, I was in your position. So don't lose hope. They probably, categories, probably that where you was at, it wasn't meant to be. Just keep advocating, keep being you, and keep using, because we feel like left out, or we feel hurt.
you know, we turn those hurt and or left out, we turn it into strength. And when you find the strength, you're gonna find your voice. And someday you're gonna say, when you look, you know, the overall, you're gonna say, based on everything that I've been through, I'm able to change somebody else's story. And with that being said, now I'm gonna mute myself. Thank you.
I know, what a great way to wrap that up. Thank you so much. And I would love to thank both Willow and Fred for this great presentation today. Their contact information or all the slides will be sent to you. Next month for office hours, we're going to have Tara Carr. She's the director in marketing of Parents Helping Parents, and that's finding families that would benefit from support. One of the funny things about family runs is sometimes we have a lot of families that are referred to us, and sometimes we don't have any. So we're going to talk about balancing that. Our contact hours and information, and Fred and Willow's contact information are on the slides. And now it's time for me to plead, like I always do. If you could, as you exit, you could fill out the survey, because we really need the information to give to SAMHSA. They were so gracious in funding today's presentation. And they asked us to ask you how we did. So please, please, please fill out the survey. That's the only way we get funding. And we will leave this slide up for Zoom for about 3 more minutes. It's so much easier if you exit on your own. It'll take you right to the survey. And after you do the survey, it'll take right to your certificate of attendance. And so you'll have both at the same time. Otherwise, you could look at, you know, the QR code, or you could look at the link in the chat, or we do send it to you as a follow-up email with the slides. But the best way, exit on your own, and you'll get it all done really quickly. Once again, thank you all for attending.